Now, last year, JoyNews aired a story about the lack of potable water for residents of some communities dotted along the Volta River. Now, though the island communities are surrounded by water, they consume that water at their own risk. Much of the water is contaminated through fishing, salt mining, and other human activities. Now, here are some excerpts from the report filed in 2018 by Martha Krenzel Aqua.
On our way to Afleve, the island community that doesn't have potable water, even though it is surrounded by water. Now we are going to check how they have been able to manage so far, how the water they have has transformed their lives, even though their fishing activities and other livelihoods have been affected by what they used to do. So very soon we'll get to Afleve and then we'll find out how the new water system the people on that island has changed their lives. From Adafo to Sugakope, there are many island communities dotted along the Volta River. These communities are surrounded by water, yet, fact is, they consume that water at their own risk. Much of the water is contaminated through fishing, salt mining, and other human activities. Today, I am taking a trip to one of the communities, Afleve, to find out how they feel living in the midst of plenty and yet have none. It makes a lot of sense to think surrounded by water means you lack none. But some women in Afleve tell me the cost they paid when they used to drink from the Volta River was high.
The previous one, we've been drinking from the natural river. There are debts, we've seen them. But with this purified one, we see that there is a great change.
Today, they are certain the mechanized water treatment has saved them and their families from frequent visits to the hospital.
Those days, our children, when they go to school, the teachers call us. The children are having acute stomach pain or chronic stomach pain, or they are vomiting up and down every day. There are problems in the school with the school children. Since this device was installed, such calls have not come again. Teachers don't call us to tell us our children are in pain or they are sick at school anymore. And we, the parents as well, we don't buy pure water like we used to buy those days.
Assembly member for Afleve Azakba Alokbem electoral area explains they have now studied the pattern and noticed the tides increase the salt content of the river every 2 weeks.
It's tasty.
So
it's salty, yeah.
The salt in it comes all the way here.
Yes, the salt in it, whenever it's high time, the salt on it. Yeah. So you can taste it, put it into your mouth, you can see. And also you can, when you see the surface of the river, you see the river tends to be some colors. When it's coming, you see there's some colors, the water has mixed with the salt sea. So you can see it by seeing it on the river and also tasting it when you put it into our mouth.
Now, World Water Day, which falls on the 22nd of March every year, is about focusing attention on the importance of water. Now, this year's theme, Leaving No One Behind, adapts the central premise of the 2030 Agenda for Sustainable Development. And 1 year on, what exactly has changed? The medical superintendent of the Adan East District Hospital, Dr. Philip Na, and representative of Easy Water, Harrison Mate, have been telling me that potable water has now reached 7 island communities. The 22nd of March every year is about focusing attention on the importance of water. This year's theme, Leaving No One Behind, adapts the central premise of the 2030 Agenda for Sustainable Development, that as sustainable development progresses, everyone must benefit. Well, 1 year on, what has changed? There are 7 island communities involved, and I've been joined in the studio by the medical superintendent of the Adan East District Hospital, Dr. Philip Na. Also with us is Harrison Mate with Easy Water. Gentlemen, so nice of you to join us. So it's been a year since the story broke. Tell us about the situation today. Has anything changed?
Yeah, so I'll say good morning to you once again. Last year when the story was done, we only had 5 sites in the island communities, and the island communities are surrounded by the Volta River, where all these communities have access to water, which is the fresh water from the Volta River, but then it's not wholesome and clean for drinking. Currently we have 9 sites. We also have 4 underway, which should be completed by the ending of April 2019. So we'd say we've made some progress. The reason for doing that is to make sure that children, especially under age 5, are free from diarrhea diseases and from kidney diseases. And these are all related to water. And I would say with the health aspect, I'll pass on to Dr. Na to deal with that.
Yeah, in fact, I was going to ask you, there were lots of reports of diarrhea.
Yes.
Back then as a result of this water problem. Has that improved?
Yes, thank you very much. Actually, it has improved. What we are doing now is still collecting data. Actually, before we had these machines, we were having a lot of these diarrhea diseases. So now that they have the machine that purifies the water that they are drinking, we are also gathering data. Although we haven't completed the research fully, but with the few data that we've collected, we've seen that the incidence of diarrhea cases are going down, and it is helping. So like Harrison said, now that we are having more machines, the number of people who are now drinking from the treated water has increased, and it's helping them. So the health impact on the people there, it is positive. It's
wonderful. I'm sure it's also had an impact on how you deliver healthcare in the community.
Yes, definitely. You know, those times when we used to have a lot of these cases, they do come to the facilities. We need to buy drugs and other things. But now, like I say, as the incidence is going down, our workload, I must say, is going down. And the most important thing is that the health of the people, especially the children. You know, one thing that initially we didn't recognize, that Adan, where those islands are the lower Volta basin, and it is heavily polluted. So with now this research and education and having this machine to purify the water, we have seen mass improvement.
That's a relief. Let's look to the future. What's the plan? How are we going to extend potable water to these island communities?
All right. So for this year, we plan to do 22 more communities in the island communities. We've also made some partnerships with other organizations who are also into water. So in the Ashanti region, we plan to do 15 more communities. 5 is underway. We are hoping that the devices will arrive soon. In the OT region, which is a new and Dambai area, we have also identified 2 communities, because also along the Volta Lake, we'll be sending 2 devices next year. Also in Afram Plains, also surrounded by water, we are sending 2 devices there. We also identified another organization there that we'll be working with. So for progress, in all this year, we hope to do about 60 communities, provided things go well, because we are still raising funds, and once fundraising goes well, it means that we can move in to support all these communities.
Now, I'm assuming government is fully aware of this situation and has been for a long, long time. Yes. As private efforts are being made, what's the long-term plan? Has government said, oh, we intend to have water there by 2030 or 2040? Or any such plan?
Yeah, but thank you very much. In fact, we are collaborating with the District Assembly to support this NGO to get more of the equipments and install them. You know, I must say that what they are doing, it is not secret. And we took them through all the process that are needed. For instance, the equipment that they brought, it has to go through the standard, Ghana Standard Authority. Yeah. The water that is purified, Ghana Water and Research Institute has to test it and all those things. So it's something that the government is aware. We have also been given license to take the data and also allow people to drink from that machine. So the district assembly is helping a lot, but just that, you know, at the government side, at times they wish to do more, but maybe the funds are not there. So I cannot tell you maybe in the next 5 years. We hope to expand, but we rather call on other NGOs, other benevolent societies that could help us get the water. Pediatokopi Islands, as we speak now, they don't have electricity. And crossing and coming, it's a bit easy. Those people there are a bit marginalized. So it is a bit difficult to get. So we call on other people to help Easy Water to expand.
But as far as you're aware, there isn't a specific
yes,
plan.
I cannot
Dates.
So we've been in touch with